When you walk into a healthcare institution or a clinic, what you want to know is, have you got your efforts worth? For a long, long time in this country, we've not bothered about data at all. So now we have our numbers. We know what cancers, who's getting them more. You had not enough mind space, not enough time to listen to your own body. Out of 10 people with a heartburn, who knows? One of them or half of them, the heartburn may have been because of a gastric cancer.
So, how has cancer care scenario changed or rather evolved in the last one decade in India?
Oh, tremendously, tremendously. First of all, in terms of attitude, and you being India specific, so let me, whatever is happening in the world, remember, globally, will happen in India as well because we are a part of that world. And even more so now than ever before, with so many things connecting us, the kind of information technology, the metaverses and so on, connecting us so intensely. So whatever happens in, for instance, United States or Canada, you can imagine will happen in India maybe 2 years later, maybe 5 years later. Earlier, it was about 5 to 7 years later, but now it's even faster, sometimes concomitantly, because of how we are connected across the globe, the newer things travel fast. So that's more likely to happen now. So it's changed considerably, that attitude of resignation and giving into something which seems like a near death or similar kind of situation has changed to one of being aggressive against the disease, of trying to do something about it. Research has come in a big way, and so has evidence. So the treatment of, there is more records available now. Everything starts with research, and research is the backbone of research, and informed decision making is data. So for a long, long time in this country, we've not bothered about data at all. I mean, even people like me, in this respect, I call myself an old timer because I'm still bound to the leather bound books but the new world isn't. My colleagues aren't. They take immediately to the gadgets and to whatever. So data is now, there is a national cancer registry which is formed out of the hospital-based cancer registries and out of registries in the community. So you've started getting, I can't say we are perfect with that at the moment, but we are much better than we were a decade back. So now we have our numbers. We know what cancers, who's getting them more, where, what age group, which sexes, which part of the country. So therefore we can take informed decisions regarding their prevention as well, or how to deal with them. So we are much better at it now. And when I say cancers, I'm talking to you across the board, because more that things look different at some level, more they are the same. A lot of things differentiate at a later level. Initially, problems are problems. They have the same kind of methodology as they evolve. So we've become more record conscious, data conscious as human beings, as healthcare providers, as people in the community, maybe even patients, one hopes so. So the whole ecosystem has become more data driven, more informed decisions, so therefore research oriented. So therefore you contribute to research. It can't happen without the numbers. You contribute to meta-analysis. You contribute to research that's happening in other parts of the world. Today, there is the same trial. It gets done much quickly and much better because you're using algorithms, you're using machine learning, using artificial intelligence. More importantly, you're cross-connected across the world. So your data sizes are really, really big. So that is why we've become better at it. We are now able to save a lot more people. We are now able to prevent. We are able to even improve the quality of care of these cancer patients at every level. So things have improved in terms of human infrastructure training. Things have improved in terms of the provision of technical infrastructure across the country. Things have improved, although a little bit not so much as far as the distribution of this infrastructure is concerned. It's not always important, the numbers are not always important. It's the quality and how those numbers are distributed that are also important. It came to the fore during the COVID. None of us will forget the oxygen crisis. And then you realize why it was happening, because most of your oxygen plants were concentrated in an area in only one part of the country, and each state didn't allow them to travel through them and kept fighting with each other. And so it was a fiasco. So not enough planning had been done. We are better at it. We are conscious at it. We've taken cognizance of our failures and mistakes. And I hope all that is, it's not just my being absolutely optimistic. It is actually what's really happening out there in the world around me.
What are the latest technological advancements in cancer treatment in India?
Oh, many actually. It is. This is a. For people would say that we are living in a world where so much is happening, and that is happening so fast that it's fascinating. It is so much of research that has happened across the globe, and like I said, India is now interconnected much better, and we are part of that research as well through meta-analysis. But and sample sizes are from India as well. So advancement at every level, diagnostics, you have genomic analysis now, and molecular. You have labs which identify mutations in various cancers and then target and suggest drugs that will target those mutations. And most of the time, these drugs are tablets, for instance, or immunotherapy is another. So tyrosine kinase inhibitors and targeted therapy is a reality for my patients in India today. Wasn't that earlier? Number two, immunotherapy. You can now better coax your immune systems to help you fight cancers more effectively. CAR T cell therapy, the example is dostarlimab, that wonder drug that the entire world heard about and talked about, where in a trial all the rectal cancers disappeared, no matter how advanced they were. What was that? That was basically an immunotherapy agent which excited your immune system and overpowered the cancer cells and killed it completely. So immunotherapy has come to the fore. Another thing, very, very important, is the fact that medical gadgets now, remote monitoring, home monitoring of devices, from you can perform surgeries to 5G by augmented reality. What about the proton therapy machines, more precise, that have come? They're available to us in this country now. They were not available earlier. Most of the machines for radiation were Theratrons. They were Cobalt 60 machines earlier. Now they're linear accelerators, better focused, less side effects, good quality control, and so many other things now. That wasn't there earlier. So in terms of technical infrastructure, we have improved. In terms of human infrastructure, robotic surgery is part of almost every major city in India today. You can see even smaller towns, B and C towns, now participating in all these changes. So research to that extent has been translational. It needs to get more homogeneous, more evenly spread across the country. That is not happening still, but we're on the right path.
How do you see precision oncology affecting the treatment landscape?
Ah, precision oncology is personalized oncology. Let me give you an example. You go to a mall to buy, for instance, a suit for yourself, and you go to this Hugo Boss counter or whatever. I like Hugo Boss, so I use this word. And you say, okay, this size, this size, this size. They make them in sizes, standard sizes. But the truth is, human beings are not standard sizes at all. They are different in different parts of the body. No two human beings are alike. They aren't, Nor, that's why the iris, nothing is alike. So when it's much better, that's why it has also been traditionally more costly to walk into Austin Reed, for instance, and have a bespoke suit made. Why? Because that gentleman would measure you point by point and make you a suit which will exactly clothe you and line you without any cracks and crevices exactly cover every part of the body appropriately. In fact, give you the best fit. That's what precision oncology is. It's a fit for you because no, this disease is different in different people. Your biological characteristics, your own immune status is different. The same disease, the same stage will behave differently in two people. We all know that. It's a different story every time with every individual. Now, if I'm able to give you what is right, just right for you, lady, then I will give it to you. And that's what precision oncology not only promises, it's delivering already.
So there are two components to infrastructure. One is human resource and the other is physical infrastructure. In Indian context, how would you rate these?
I think that we are still inadequate as far as the classical terms of doctor-patient relationship ratios are concerned. We still have numbers to go. We are also inadequate in terms of the technical infrastructure, like the radiation machines required for treatment of cancer to the number of population. But it's improving. It's getting better. It's much better than what it was earlier. In the last 10 years, I think there has been a steady increase in infrastructure. What has obviously been a little late to happen is the concomitant increase in the Philippine human infrastructure, because it's not just the glass and the buildings and the stone that make a hospital. It is the people working inside these hospitals who are adequately trained to deliver that quality of service. They need to be trained as well concomitantly. So you need, now that is also happening ever since Government of India started making medical colleges in districts, and one hopes we are going through a transition as far as that is happening. It's going to take a few years for all that material to be reared and trained and to come into the market. Another 5-7 years. So another 1 decade of transition, then I think we will be truly be able to call ourselves a developed country as far as oncology care is concerned. So things were bad. They are getting better. They're on the right track. But like I said, another thing that needs to get better is not just the number of cancer institutes or cancer treatment or cancer prevention institutions. It's about how they are distributed. This country is large and wide, so it needs to be distributed homogeneously. That is an area one needs to concentrate on. It's a challenge.
So families today are running into huge debts while treating cancer patients. How do you think the situation can be improved wherein the delivery of affordable and equitable cancer care can be achieved?
Yes, I mean, this is in accordance with the WHO's goals for universal care for everyone by 2030 or whatever. My issue is that there are two issues. One is that you want equitable care, which means it should be distributed equally across the country. And therefore, alluding to what I told you earlier about our strategy and planning so that these institutes are available to people across the board, not in only in certain areas like urban areas or clusters. So one needs to work on that. That's a part of strategy and planning, which the strategists and planners of this country in the government and around them need to keep in mind. Number two, affordable. It's not just affordability that is important. Affordability is one aspect. Okay, if I tell you that even a country like North America, which one considers financially the most powerful country in the developed world, and we are by WHO standards a low middle income group country, we like to call ourselves transitioning. That's because we don't like the low income group tag anymore, and we think that we are moving. We are, but we are still a transitioning country. But if America does not have enough money to pay for its advanced healthcare, do you know the single most reason for personal bankruptcy, even in the United States today, is healthcare out of pocket? So if America, with all its monies, doesn't have enough money to provide standard healthcare, and every president fights on Obamacare and Clinton care, and so which means it's so important to them, where would we stand in that ladder? You can imagine, and so can everybody. We must be a little bit lower down. We are a lot lower down. But as long as, it doesn't matter, you could be lower down, but as long as you understood it, realized it, and started going onto the right path, you're okay. Is that happening? That I'm not so sure of. We're going to find out. Yes, affordability is important. But more important than affordability is value. When you walk into a healthcare institution or a clinic, what you want to know is, have you got your efforts worth of going to that health center? Have you got your time's worth? The time that you spent visiting a health center or a clinic, did you get that work? There is a balance at the end of the mind after every interaction. Even after this interview that you're having with me, you're going to walk out and think, yeah, a scale will tell you whether was it worth it, sitting and exchanging thoughts with me. So there is a balance that comes to. It's about that balance, getting the balance right. It must be equitable. It must be available to everybody. It must not result in things like bankruptcy. It must have a provider, a healthcare provider. The Ayushman Bharat thing I must mention here in India is a way forward. But what needs to be thought through there is who's going to pay the money. So for that money to continue being paid through the Ayushman Bharat scheme, the government of India needs to increase its health spend, which at the moment, as per the GDP, is abysmal. It's small. And if you consider health important, it's come to the top of your priority list, particularly after the rude shock that COVID gave all of us, then that must happen. So it must start right at the top. It must end at the bottom with a consumer like me saying, let me adopt the right lifestyle. Let me not put pressure on my government to pay for me. Let me make sure that my health is proper, or on my personal finances, or on the financial structure of the community or the organization or the country that I live in. So it has to be done all across the board. And remember, I repeat again, the key word is value. You need good value treatment. People are upset with major hospitals because when they leave, they realize that they didn't mind paying the money, but the thing is, they felt that they didn't get what they came in for. It wasn't the value of amount of money or the effort that they put in, or the thing that went into doing this exercise was much larger than what they felt that they got out of it. When you get that balance right, you've won the game. It's about getting the balance right.
What are your recommendations on dietary habits to help avoid cancer?
Now, obviously, lifestyle is extremely important as we've gone on. We've realized that two things that really take a cake as far as the etiology, the happening of cancer in lives is concerned. One is lifestyle, and lifestyle has a lot to do with what you eat and drink and how you are. So therefore, moderate habits, everything in moderation. Even if I said tea, and let me talk about tea and alcohol. Alcohol in moderation, in 5% ethanol, is a component of every appetite stimulant that you give today. Polybion, BG, FOS. The hunger comes from that 5% ethanol. But the same ethanol, when you really kick the butt, kills you. So it's about how you deal with tea. Tea, for instance, too much of tea, you know what it does? It can too much of tannin in your body, too much of acid in your stomach can corrode the inner lining of your GI tract. But the same tea so have a balanced approach to your diet. Enough exercise, avoid obesity, red meat, quantities of red meat. Why I'm saying red? Because red meat often I've seen associated with a lot of GI cancer in this country. And lifestyle, tobacco, how much can one not talk about? In the sense, tobacco, we all know, it's that it is the major killer. Alcohol in those amounts, having a balance, like enough greens and vegetables and fruit as a part of your diet. Eat when you must. Don't keep your stomach empty. Don't ignore. Talk to your bodies. More important. Talk to your body all the time. If you have no time to talk to your own self and your body, the smaller ailments, these symptoms will pass you by. You won't even know, and you'll land up at a situation one day you get diagnosed with stage 3, stage 4 cancer. These people keep coming to the OPD and say that we never had any symptoms. I tell them, no, not possible. You didn't listen to them. You had not enough mind space, not enough time to listen to your own body. Out of 10 people with a heartburn, who knows? One of them or half of them, the heartburn may have been because of a gastric cancer. But you didn't listen. So talk now. find time for your own body and your own mind. Whether you do it, that depends on you. You do it all the time. You do it sometimes in the day. You do it at particular portions of the day, or you meditate. Do it when you meditate. I don't care how you do it. That's your problem. But be aware of your body. The body will give you messages, will say things are wrong with me. You just need to register them and then get to the right person at the right time. Do your research, go to your GP, attend, find reasons for a cough which will not go away. Don't just assume this was a viral and it'll go away. If that cough persists for more than 2 weeks, find a reason. Whether it's an anti-allergic thing that you need to be on, or whether it's an infection that's not going away, or could it be a cancer obstructing your airway? Because if you ignore that later on, these things, give cancer a bad name, um, and and why should it? I mean, I'm not saying don't give it a bad name, but I'm saying is why would you ignore it when it is time for it to be treated and get cured? When we've got those diagnostics now, they're getting better by the day. So talk to your body. Have enough time for your own self and for your own mind, is what I'd like to tell them.
So, what limitations do you face concerning patient education while treating cancer patients?
Um, the lack of patience, my own patience, being very honest, because every patient is not educated and aware of the same level, to the same level. Some of them are completely unevolved, uneducated, don't even know. There are language barriers, language problems. They're scared. They're sometimes in denial, sometimes in anger. They're malfunctioning because this is one of the worst periods of their life and that family. So they malfunction, they dysfunction. You see everything. Important thing for me as a clinician is to recognize that and then traverse those waters. They are choppy waters, but I need to navigate myself the right way, whether it takes 2 sittings, 3 sittings, how much to tell, how much not to tell, assess it, be honest, yet don't lead people up the garden path. Have a comprehensive view, maybe explain again. I've usually seen people who come for the first time, you give them information, but don't give them so much information. It becomes an overload. They are so overwhelmed by just the fact that they have a cancer in their bodies that nothing, it goes off and they don't register anything. They go back home, they remember it, they want to come back again, ask you. Give them that chance. Give people the time they need. Give people the consideration they need. Give people a leeway. Give them cut some rope so that let them make their mistakes. So I need to have that patience to be able to do that. That is number one. So it's my own battle also. I need to conquer that. Like I need to conquer ego. This is another battle. Patience, empathy, very important. And of course, being able to spend that time and energy with your patients. It is a challenge. It's easier said to you than actually done on my table. But I'm aware of it. And I think as long as I'm aware of it, I'm possibly on the right path.
Dr. Kaul, what could be helpful in preventing cancer?
It's a small question, but it encompasses so many things across the board. So a multi-level interference, right from increased awareness, the screening programs, so that you, first of all, don't primary prevention, which is not to come in contact, have the kind of lifestyle, be aware. If you have a genetic component to you, you're carrying the BRCA gene or any of these things, hereditary cancers, then you take appropriate steps that are recommended for it. Be aware. So increase the awareness level, read more, watch more, get more information. That is for average people. For governments, they need to set up specific screening programs in target populations which are needy. If young women in a particular area have this incidence, which the charts will tell them, which their demographic data will tell them, and like I said, we are getting better, so the records are important. They can direct surveillance programs, which means screenings, GI tract, head. Oral cancer is a huge problem in India, a huge challenge because of our habits. Have a screening program for oral cancer, control tobacco, promote lifestyle. Media needs to get involved. Laws need to be in place. Penalties for tobacco control, curb on advertisements. The major killers. Identify them, stay away from them. And then, if you're not able to do that, make sure that you catch them early. And so the surveillance programs, the screenings for the breast, for the colorectal, according to your incidence of cancers in a particular area, to be designed by the regional authorities and implemented on the ground. And the private world should also join in. In fact, there must be a very nice, seamless collaboration between the private and the public sector in India in the healthcare. Unless that happens, both will be working independently of each other and with, most of the time at cross purposes, and most of the time reduplicating the resources. Doesn't need to be like that. Do you know that 70% of private of healthcare that is provided in India comes from the private medical sector, even now? So one needs to be cognizant of that and therefore invite them into the system so that they have a seamless collaboration. That's when people will get benefited. So the right programs based on evidence, particular to our part, allowing people to come in, Atmanirbharta in medical devices and cancer control devices will help, making it easier for research and development and actual innovation to happen in the country, not copycat innovation, copying drugs from other countries. No, basic research right from word go must be implemented in this country and encouraged and incentivized and what have you. Unless that happens, we won't be able to catch up. So, like I said, many things to be done at many times.
Talking about breast cancer in particular, it is the most common cancer in women in India. Can this risk be reduced, and what kind of preventive measures can women take?
Like I said again, yes, it has. It has overtaken cervical cancer to be cancer number one, and in India, like in other urban cities and the developed cities. But the first thing that women awareness of who are the populations at risk. Every woman must know that is she at special risk to develop this cancer. For that, she must seek information, and the mass communication agencies of this government must get this information to her in the language and the vernacular she understands, and wherever she is in India must know that if there is a family history, she will get more cancer. So she needs to get checked for it. She needs to know if she's an elderly female with a lot of bad estrogen in her body for a longer time, she's likely to get. If she's obese, if there is increased intake of alcohol, or if there's already been a cancer in one breast, more likely to get it in the other breast. What are the pre-malignant conditions? So mammograms and screenings after a certain period in India are important, and they must be conducted region-wise, because then you will be able to pick these cancers early. If you pick them up early, you cure them. And if you don't, then you're basically just fighting against time. So we've got to get into the right slots. The important thing is it is happening. When I started my oncology practice in this country, 85% women with breast cancer were in stage 3 and stage 4 when they came to me. But now it's down to 59% to 61%, which means more of them are now getting picked up at an earlier stage. So we're on that path, and that needs to happen faster. That needs to happen more. That we need to get our cancers very early so that we can custom, and then we need to be able to treat them custom built treatment, precision, precise to that patient. That type of cancer in that patient must be treated with that methodology, bespoke treatment. So basically many interventions at many levels, and you'll see good results of future. We will prevent breast cancer in this country. Like the other, this changes. In the West, at one point of time, breast cancer was number one. It came down because they got control of all those risk factors that we just talked about. Late age at childbirth, late age at first marriage, These are risk factors again. Why? Because as long as you give adequate time for this bad estrogen hormone to play with your end organ, the breast, the chances of the likelihood of cancers becoming more is higher. Another very important thing, demographics. Our country has now more older people living. The whole world has more older. So the cancers of the old age have gotten added to the spectrum, and even breast cancer is age is a risk factor. The older you are, your chances of getting breast cancer increase that much. So as you have older people, the cancers of the old will get added, like the prostate in the men, like the breast in the women. They'll get added.